Hi everyone. Today I want to talk about medication. I get lots of messages about medication and what medications to use and how do I keep my pigeons healthy, especially for the new starter or the novice fancier. I get messages every week about it. So this is what I used to do quite a few years ago now, probably 20 years ago now. And I must stress, I don't do it now because I don't agree with blind treating. And this way is blind treating. But if you need to keep your birds healthy, this is a program that I used to do. So you start off before the racing season, old or young. You would give them a full treatment of cocci, canker, worms, and respiratory. And in between each treatment, you would give them some probiotics. So that's before racing starts. So you'll need to give yourself probably 3 weeks before racing starts to get all the treatments done. So now racing starts week 1. So your birds go racing, if they race on a Friday, if they basket on a Friday, race on a Saturday, the Sunday is the day I always do my treatments. Week 1, so they go to the race, they come back. First week, a canker treatment. I would use something like Rondazil. You only use it for 1 day on the Sunday, and then on the Monday, they would be back on to probiotics. After every treatment, I would give probiotics. But seeing they've already had a full course, you're only doing this for 1 day. And it's a 4-weekly treatment. So the program is a 4-weekly program. So week 1, canker. Week 2, worms. Worms is only a 1-day treatment anyway. I like to use throughout the racing season, moxidectin. Those two products are really easy to get hold of. Most places will get it. Rondazil, I use 10% Rondazil. Moxidectin, the strength for moxidectin is 10%, and they would get 5 ml per litre of moxidectin. If you get the 5% moxidectin, you would need 10 ml per litre. So that's week 2 on the Sunday. Week 3 on the Sunday, cocci them. I like using Baycox during the racing season. Now, it is difficult to get hold of. It is a prescription drug. So if you haven't got your ways of getting hold of it, you'll need to get a prescription. Baycox is a really good one to use through the racing season. It doesn't seem to affect them. None of these products seem to affect them, but you must always do it on a Sunday. So week 3, coccidiosis treatment on the Sunday, just for 1 day. On the Monday then, probiotics. Now week 4, a respiratory treatment. I like to use Doxy-T. It's a combination of Tylan and doxycycline. It's a really good respiratory treatment. The full treatment is 5 to 7 days, but on the program, you're only using it for 1 day on the Sunday. There is a chart that will come up on the screen of when to do it and how long for. So that's basically a 4-weekly treatment. So now you go to week 5, they're back on a canker treatment. Week 6, they're back on a worm treatment. Week 7, they're on a cocci treatment. Then week 8, they're on a respiratory treatment. That's the way I do it, and I do it in that order. Simply because it tends to work for the worms, because the worms is the last treatment that I'll give them before they go racing. Because worms, you need to be able to break the cycle, you need 2 weeks in between. 10 days to 2 weeks, 10 to 14 days in between your first treatment and your second treatment. So the week before racing, I'll worm them on their full course, 24 hours. and then after week 2 they'll be wormed again. So look at the chart, study the chart. That's basically something that I used to do. I don't do it anymore, but it does keep your birds healthy. It keeps all the counts of everything down. Worms you need to eradicate completely. You don't want any worm eggs in their drop-ins. So that's my treatment plan. You cannot beat going to the vets and getting them tested. If there's anybody in your area that tests for coccicanker worms, they'll probably do other tests as well for salmonella. There's lots of different tests. They can be quite expensive, but if you weigh up how much it costs to get the test done and buying these treatments, it's probably just as cheap to get the test done than blind treating. If you get the test done instead of blind treating, it's better for the birds. The less medication that you can give them and the more natural products you can give them, in my opinion, is far better. So I hope this video helps. I'm not a vet. I'm a pigeon fancier. So if it's something that you want to try, you try it, but you do it on your own, off your own back, because I am not a vet. Hope it helps you anyway. Take care.